The most important and challenging part in ERCP is cannulation. The guide wire is an essential device for cannulation and influences the cannulation process. What is the most important feature that you expect from the guide wire?
So very important for cannulation, even if it's a standard cannulation or difficult cannulation, to have a reliable instrument and the accessory for that. Of course, we have the wire loaded already into the sphincterotome, so we usually use the wire-assisted cannulation, and mostly we use the VisiGlide with the CleverCut sphincterotome together to get into the desired duct.
Do the endoscopic markers and X-ray markers of VisiGlide help you also with the rest of the procedure, especially during stenting?
No, actually, first of all, the wire is very important to have the access all the time. If we already are in the desired duct, so keep that wire inside. So if we use the short wire system, it's easy because, with the elevator and the V system, it's easy to when we are exchanging the instruments. But it's very important to see under the fluoroscopy very well the wire, and as well when we are exchanging the accessories or putting a stand, when the wire is safe and in a not moving position.
Does the stable 11 o'clock orientation of the CleverCut actually help you in order to safely perform sphincterotomy?
The key step is getting into the desired duct. And with the CleverCut, it's a reliable product, so it means that the orientation is all the time. When I advance it through the scope into the lumen, into the duodenum, that it will have the same, direction what we expect from it. So that's why getting into the bile duct, usually we cannulate towards to the 11 o'clock position. And by bowing, the tip, the tapered tip of the sphincterotome, you can, by placing it into the orifice, we can also help with a deep biliary cannulation after getting the wire easier into the bile duct.
Talking about extraction balloons, what are the features and what does the extraction balloon do for you?
With the stone extraction balloon, what I like most is that, it's visible under the fluoroscopy. It's easy to handle. It's not so thick. It means in terms of, advancing it through the elevator and by the elevator. And also when inflating it into the good size in terms of the CBD diameter, to have it like a symmetric. So that's why I like the shape of this balloon, extraction balloon, what we are using.
When do you choose mechanical lithotripsy over the EHL under cholangioscopy?
What is the mainstay and the key? That easy handling. I know that this metal sheet, which we are using, which is against the Dormia basket wires, how we actually crack the stones, and it's not easy sometimes to handle and get into the bile duct, but it has an inner plastic sheet, which one we can use for cannulation, and after when we advance the metal over this plastic sheet is getting into the duct, and it's also very important for us that the Dormia basket keeps its shape. So it means that, after crushing stones, it can be actually reused for the next crushing.
Which features of Olympus duodenoscopes do you value the most?
I like the duodenoscopes, Olympus duodenoscopes, in terms of easy handling, maneuvering, getting down to the papilla. It's easy to get there if you get used to that. And also the feature, what I like, is the virtual chromoendoscopy. Because in terms when we are doing papillectomy, it's very important to use the MBI to see the borders of the adenoma of the papilla. And also it's important for us to have a nice vision to the papilla and to have a broad vision and having it reliable, even if we are using the elevator, that the elevator doesn't, decrease the vision to the papilla. And of course the working channels and the elevator is very important and reliable if it works well. So this is one of the needs for the success for the ERCP.
How do you see the development and importance of the single-use duodenoscopes in 5 years?
Single-use duodenoscopes are for specific cases and for specific selected patients in selected scenarios.
What do you like about the Olympus products in general?
So in terms of intraductal mechanical lithotripsy, the LithoCrushV is reliable, and we like by the plastic sheet, which is thinner, by advancing it into the bile duct, after it can follow by the metal sheet, And by closing the metal sheet against the dormia basket, we can do it and we can do the crushing of the stones.